A lot of people come in for lower back pain. So in the next couple minutes, what we're going to do is we're going to talk about low back. I'm Dr. Walsh. I've been here in Hagerstown treating patients since 2018, actually. I'm now at Walsh Chiropractic and Physical Therapy in Hagerstown. So the first thing we're going to talk about is low back pain. Low back pain is pretty general. There's a lot of different things that can happen with low back pain, but typically with just I'm sore, I can't move, I might be in spasm, you've got a couple things going on, and it could be anything actually. Weekend warrior, especially in the spring, people come out, after the winter and they're not doing a lot, and then next thing you know, they're doing some yard work and they come in here, low back's bothering them. They've been, spent all weekend bent over, putting in mulch, doing something with the yard, weeding, what have you. Doesn't matter. That's typically an overuse, fatigue of basically a couple of muscles. Your paraspinals that come down on each side. Then you have multifidus underneath and QL. Those are your three main muscles that do things for the low back. And with that, that's kind of easy because what happens is with any fatigue muscle, it becomes overused. Then what happens is it'll go into a tight spasm. It can cause pain depending upon motion, position, posture, what have you. It's not really that bad. What you do typically is, as a physical therapist and as a chiro, you adjust, of course. You do different techniques and stretches to loosen it up. Typically, I don't like to exercise a fatigued muscle that's in spasm. The chances are of you sending it further into spasm is pretty high. So I do a couple stages. The first stage, critical stage, is I like to treat the issue, try to get you in as much comfort as possible as early as we can. Once the muscle reaches a certain level of relaxation and stays there, then we can start to work on the problem. There's only about two things with muscles, especially in this condition. Number one, muscles aren't either strong enough or they don't have the endurance. And that's typically more of an endurance. Right? So you're in a position and it's holding you up for a certain amount of time that's not normal for you. It gets fatigued. It's just not used to doing that. You don't have to be super strong, but you do have to have a certain endurance. Deadlifting, injury, that could be strength coupled with a disc issue. And that depends, So there's a lot of variability in low back pain. And that's basically it. So what we do is when the patient comes in, number one, we get the history. We get the mode of injury. And then we do different tests, orthopedic tests to discern, the severity and what's going on. Is there any radiculopathy, anything running down the leg or, halfway down the leg, sciatica, things like that, where a disc can be. So that's about it for low back.